This is video 3. I wanted just to make note before I begin that I will only be performing exam to one side of the body just for time-saving purposes, but that in a real exam and doing a physical exam for a patient, I would be doing a full bilateral physical examination to both sides. But just wanted to let the instructor know that to save time, it's only for one side. Thank you. So to begin here, I'm going to introduce myself. My name is Shelley. I'm going to be your nurse practitioner today. What brings you in?
My lower back hurts.
Your lower back hurts. Okay, so what do you think is wrong?
I think I may have pulled it moving boxes in my garage.
Okay, and when did the back start hurting?
It started in the early evening after I moved the boxes.
Okay, and what makes it better?
If I don't bend down or lift anything.
Okay, so that makes it worse if you bend down and lift something?
Yes.
Okay. Are you sleeping at night?
Yes.
And you're able to go to work?
Yes.
Okay. And how have you been doing, what have you been doing to alleviate their symptoms?
I've been taking Motrin every 6 hours.
Okay. And are you still lifting boxes?
No.
Okay. And I'm just going to ask you kind of like a list of questions. Have you had any trauma?
No.
To the back?
No.
Okay. Have you fallen?
No.
Okay. Have you had any past hospitalizations or surgeries?
No.
Okay. Do you have any chronic conditions?
No.
Okay. Are you on any medications?
No, just the Motrin.
Okay. And then do you have any allergies to food, medicines, seasonal?
No.
Okay. And let's see here. Have you had any changes in your weight?
No.
Okay. Let's talk about your pain. Is it gradual or did it just, immediately happen?
I mean, it's aching.
Okay. Okay. So when you hurt your back, did it immediately hurt or did it just kind of gradually onset?
Gradually.
Okay. And then I guess is it constant, the pain, the ache, or is it kind of come and go?
It's only when I bend over.
Okay. And then for a pain score, 0 being no pain at all, 10 being the worst pain in your life, what number could you give me?
It's a 3 when I bend over.
When you bend over. All right. And does your pain radiate anywhere else?
No.
I'd like to perform a physical exam. Would that be okay with you?
Yes.
Okay. So I'm going to ask you to perform a lot of movements. Any of those movements, please let me know if you have any problems, if you're feeling any abnormalities, or if you're having any pain.
Okay.
All right, so I first want to start with my mental exam, and that is asking your name.
Michael.
And your date of birth.
April 24th, 1972.
And where are you right now?
In the clinic.
Okay. Okay, and let's do some memory. So I'm going to just get you to memorize these 3 words, baby, piano, and tree.
Okay.
Okay. Where were you born?
Detroit, Michigan.
Okay. And what did you have for breakfast?
Cereal.
Cereal. Okay. I'm going to test your judgment. What would you do if your house was on fire?
Get out of the house and call 911.
Okay. All right. And then also too, I'm going to ask you what this means. What does it mean when it's raining cats and dogs outside?
It's raining very hard.
Okay. And then I'd also like to ask you, I know this is simple questions, but who is the President of the United States?
Barack Obama.
And who's President-elect?
Donald Trump.
Okay. I want you to do some subtraction for me. If you can subtract by 2s, starting at 20.
20, 18, 16, 14, 12, 10, 8, 6, 4, 2, 0.
Great. And then if you can recall the 3 words that I told you earlier.
Baby, piano, tree.
Okay, great. I'm going to start getting you to move a little bit. So this is where I want to test certain movements. Okay. If you could, let's do some coordination. If you could take your hands, I want you to place your palms onto your knees. And then I'd like you to place the back of your palms on your knee, or the back of your hands on your knees, and go back and forth. Great. Now go a little faster, and then go as fast as you possibly can. Perfect. Great. Our next test, I want you to take your thumb and touch all of your fingertips, if you can, with your thumb, just like so. There we go. And then go back again, if you could go as fast as you possibly can. Great. Okay. Next, I'd like you to take the heel of one of your foot and put it towards your knee. And then take your the heel and touch your other shin. Great. If you could do it your other foot. And then again, one more time. Great. All right. Next, I'd like you to tap your foot. So I'm going to place, if you place your hand right here, and just tap my hand with your foot. Great. Let's do the other one. Perfect. Now let's test how stable you are on your feet. So go ahead and stand up. I want you to just close your eyes if you can, and then do some nice deep breathing. There you go. And then open your eyes. All right. Do you feel unsteady? No. Okay. If you could do me a favor and just walk, turn and walk towards the door there. Okay. And then come back. And then just stand in front of me. All right, so right now I'm just looking at your gait. I'm making sure that you're steady, you've got ease in movements, relax a little. Then basically I'm just making sure that you don't look unsteady. Your arm, you've got good arm swing. Right now I'm looking at your posture, so I'm going to come around and look. I'm looking at your cervical and lumbar spines, making sure that there is a concave curve. Next, what I'd like you, I'm looking at your limb symmetry, making sure that both limbs, upper as well as lower extremities bilaterally, I don't see any deformities. There's nothing in length. They all look pretty much equal in length. Next, what I'd like to do is I've looked at your gait, I've looked at your posture. The next, let's take a look at your back. So what I'd like to do is I'm inspecting your back. Next, I'll palpate, so I'll go down to the spine, making sure that there's no nodules, no tenderness, swelling. And I'm going down to the iliac crests, and everything is smooth, firm. Now I'd like you to test your range of motion. We're going to do some active range of motion, so if you can just kind of mimic me. What I'd like you to do is we're going to do the flexation of your back. If you could bend down and touch your toes. And then what I'd like you to do is just come up halfway to your waist, and then come back again. So we've also done the Adams test. Now let's do some hyperextension for your back. What I'd like you to do is just raise your arms above your head, and if you can kind of just tilt your back up, there we go. And then back again, and put your arms down to your waist, and then just push your arms back. Great. Next, I'd like to do kind of like a lateral rotation, so just stabilize your hips, and then why don't you just kind of move your hips back and forth. Do you have any tenderness or pain? No. Okay, great. Now I want you to just kind of move side to side, so I want you to just reach down, see if you can touch your knee, and then reach down and see if you can touch your knee. Great. Let's look at your shoulders. So I'm inspecting your shoulders. Everything's equal. I'm taking and looking around, and then I'm going to palpate your shoulders. We're going to go around. Right now I'm going to just do one side of the shoulder just to save time. In a physical examination with the patient, I would do both. So we're just looking at the scapula here. Now what I'd like to do is some range of motion on the shoulders. So what we're going to do is if you can shrug your shoulders, like you can put your shoulders up to your ears. That's great. Next, I want you to do some extension. So what I'd like to do is just put your shoulders off to the side. All right. And then up and then up over your head. then down below, and then out again, hyperextension. Great. And then put your shoulders out to the side. Then you're going to take one hand, preferably your left. Actually, let's do your right. And then we'll do your right hand, and then just go over here. Great. What I'm going to do is then test to make sure that, let's see here. I'm going to get you to raise your shoulders, and then I'm going to press down. Please try to get me to not move your shoulders. That's great. Now I want you to cross one of your arms over, and then I'm going to try and move. Do you have anything that hurts?
No.
Okay. Great. Next, what I want to do is just do some testing. So we're going to do a drop arm test. This drop arm test helps to determine if there's a rotator cuff tear. So I'm going to get you to put your hands up into the air as such, and then tray it all the way up to over your head. And then I want you to lower them down slowly to a 90 degree, and then just hold it there. If one arm did drop, that would be a sign of possible rotator cuff. Go ahead and put your hands down. Next, I'm going to do the near impingement test. This actually tests for tendonitis. So at this time, I'm just going to take the arm, I'm going to cross it over, and I'm going to extend a little bit, and then pull out, palm out. Any tenderness in the tendon?
No.
No? Okay. Great. Let's go towards the elbow. So we're going to do the elbow test. And so what I'm doing is I'm looking at the elbow. I'm inspecting the elbow. Now I'm going to palpate the elbow. See if there's any swelling, nodules, redness, tenderness, and such. There isn't. Great. So now I'm going to just get you to flex your elbow and go up. And then push your elbow down, and then let's hyperextend your elbow and push it out. Great. Next, what we're going to do is we are going to do a pitcher's test. So I'm going to get you just to put your hands up like so, and then I want you to rotate your arm out. Then we're going to extend your arm as such, and then push it back. Any tenderness?
No.
Okay. And then we'll do a, let's do the test for golfers. So at this time, what we're going to do is I'm going to just pull out, extend, and then pull here. Any tenderness there?
No.
Great. Okay. Also, too, if you can put your hands out as such, and then we're going to, this is supinate, and then we're going to pronate, so just turn your elbow in. Great. Now, I like to do your wrist, hands, and your fingers all at the same time. Excuse me. Okay. Then let's look at your wrist. So I'm going to inspect your wrist. Go ahead and flip them down. And then we're going to palpate. So I'm palpating the wrist. I'm going also to include the hands. I'm also looking at the fingers, making sure that there's no swelling, tenderness. And then we're looking at, I'm touching all the joints. We're going to do a couple of hands, couple of test here. I like to do a flexation. So just go ahead and take your hands. You can take both of them and then go all the way up and then all the way down. Great. Let's do your fingers. We'll go fingers down and flex fingers out. Let's put in a fist and then fan fingers out. Great. Wonderful. Next, we're going to do inversion. So if you can take your wrists and invert it this way, and then let's go the other way. Perfect. Great. I'd also like to do a another test, which is called the Fallon test. And you're going to just put your hands together. What I would do is I would compress here and push as hard as I can. I do that for about a minute. If you start feeling any tenderness, tingling, numbness, that could be a positive sign for carpal tunnel. I'm not going to wait it for a whole minute. And then the next test I'm going to do is the tinsel test. And at that time, I would take, and then I would actually push down on the carpal area of the hand, keeping the tenderness, tingling, whatnot. Okay. Great. Let's move towards the hips. So right now, I'm going to get you to lay down. I'm going to go back to the back and get him to do the straight leg raise. So go ahead and raise one leg all the way up straight. Great. Do you have any pain there in that lower back?
No.
Okay, go ahead. All right, now what I'd like to do is inspecting the hips, making sure everything looks nice, nothing's abnormal, I don't see any deformities, a little bit of swelling, tenderness. Now I'm going to actually palpate the hips and push, making sure that there's no jostling and that everything's intact. Excuse me. Next, if you could actually lift up your leg, bend your knee. Great. Put your knees down. I'm sorry. Now we're going to go for the hips. Next two, I would like you, if you could sit back up. Let me help you. All right. Go ahead and extend your leg out, if you could. Now cross your, let's just cross this leg over that one. Perfect. Any problems there? Any tenderness?
No.
Okay. All right. Let's do some strength. So what I'm going to do is if you could take out your leg, push it towards me. There we go. I'm going to actually hold on to your leg, and I'm going to see if I can actually pull your leg in. There we go. It's not budging. Great, great strength. And then, of course, I just want to reiterate, if this was a physical examination with the patient, I would do both sides. Let's go for your knees. So I'm actually inspecting the knees. Taking a look at the knees. And everything's normal. I don't see any abnormalities, no deformities. Now we're going to palpate. I'm just going to go up and palpate down. All right, everything's normal. Now what I'd like to do is get you to go ahead and let's stand up if you can. I want you to raise your leg and then kick out your leg if you could. Great. Put your leg down. And then I want you to push your leg back. So go ahead and step forward. And push your head back. Great. Use me as balance. Perfect. Go ahead and put your leg down. That's wonderful. Let's see here. Now let's go ahead and get you to sit back down. And then let's lay down. Then we're going to do a couple of tests. One, I want to do a strength test. So go ahead and put your knee up. And then I'm going to see if I can move your leg outwards. And just kind of like, don't let me move your hand. Or excuse me, your knee. There you go. Go ahead and lay it down. All right. Next is we're going to do some, a posterior anterior drawer test. So I'm just going to take his knee here. And I'm going to hold it here. And we're going to actually test to see if he has an ACL injury as well as a PCL injury. Go ahead and bend your knee. And then we're just going to take it here. And we're going to see if we can kind of move it. And if there's any tenderness in there. And it's actually locked. So there is no movement when I actually move. So that's good. Then we're going to do a Lockman test. Lockman test here is going to put a hand on the femur, put it on the tibia. And then I'm going to kind of just jiggle a little bit, and that's normal. Next is we're going to do the McMurray test. I'm going to have my hand underneath the knee, then I'm going to have my hand on the heel, and then we're just going to kind of move out and extend, and then inward and extend. Great. Go ahead and sit up. All right. Now actually not last, we're going to do ankles, feet, and toes, and then we're going to go back to reflexes. So what I'd like you to do is go ahead and kind of like take your toes, your ankles, and flex them up, and then point them. Flex them up, and point them. I'm actually going to inspect as well. I see here is this an old scar to your ankle?
Yes.
Okay, great. And then go ahead and flex it again. And then I'm going to just kind of like palpate to make sure that everything's intact. I don't feel anything abnormal. All right. What I'd like you to do is have one leg and kick it out. Go ahead and curl your toes, straighten your toes, and then fan out your toes if you can. There we go. Perfect. Take your ankles, if you can, and just put it out a little bit. And then what we're going to do is kind of like turn it in and then turn it out. Great. Let's go back to reflexes. What I'd like to do is we're going to do kind of like backtrack, and we're going to do accuracy of movement, which wasn't done. So we did a toe tapping, which is great. Now what I'd like you to do is take your finger and touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. Great. Now what I'd like you to do is have your arms straight, then take one hand, touch your nose, the other hand, touch your nose. Try to go as fast as you can, and then just a little bit faster. Awesome. Great. Let's test some sensation. So I'm going to take a cotton ball and actually touch parts of your body, and then you just say yes when I have touched you. So at this time, you're going to get you to close your eyes.
Yes. 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 Yes.
Great. Now, we'd also like to test your sensation to dullness and sharpness. We're almost done. So when I touch something with dull, I want you to say dull. When I touch it with sharp, say sharp.
Dull. Dull. Sharp. Sharp.
Great. All right. Our next test here is going to identify upwards and downwards. So I'm going to take your toes and your fingers and kind of lift them up and lift them down. When your eyes are closed, I want you to let me know if I lifted them up or lifted them down.
Okay. Up. Down.
Great. Let's go for your toe.
Down. Up.
Great. Now I'm going to test some reflexes. I'd like to start off doing your abdomen reflexes and then your feet, and then we'll go with your biceps and then back down to your feet again. So go ahead and lay down if you can, and if I get you to lift up your shirt. All right. So we're just going to test all 4 quadrants and moving away from the umbilicus. Great. Now I'm going to test your foot. Of course, in a physical exam, I would do both sides. I'm making sure that no toes are fanning out. The toes are fanning out. Go ahead and sit up. There's one more test I did not do. I just want to make sure you feel the sensation. So let me know if you feel the sensation. Do you feel the sensation?
Yes.
Great. Do you feel the sensation?
Yes.
Great. Now for reflexes, and that's it. And then we'll be almost done with our exam. Then we'll do a verbal report. I'm going to start off here with the biceps. So I'm just going to come around here, tap, and turn. There we go. And there's our bicep, and let's do a forearm. And I've actually hit the skin for the forearm. Great. Then we're going to go back. We'll do tricep. We'll do the tricep. Great. Next, we'll do our kneecap or our plantar. We'll do, excuse me. Great. Then we'll do our Achilles. Great. And then we're going to do quads. So a quads would basically, I would take and I would go up, down, up, down, up, down. And that is fine there. All right, Michael, thank you so much. I'll get you to tend to the baby if you can, or I'm going to give a verbal report. I'm sorry for the baby crying, excuse me. I have finished the physical examination for video 3. This is Michael, who's a 44-year-old male. He's presenting with lower back pain. He states that his back had started hurting after he moving some heavy boxes from the garage. The patient does not have history of back problems, trauma, or surgery. He denies any allergy. The last couple of days, he's been taking some Motrin every 6 hours. Excuse me. And he said that that has helped to alleviate his pain. I advised him to also stay off his back, so rest is probably the best policy for him. Patient doesn't have any family history of back problems. He states that he doesn't exercise regularly, but he's pretty active around the house. He shows no sign of acute distress. He's alert and oriented ×3. He responds appropriately to questions and commands. Upon examination, the patient does grimace when he does bend over, but his patient's gait is steady. There's no loss of coordination or sensation. Reflexes are intact, and he's able to complete range of motion, active range of motion, and no other exam findings. All other exam findings are within normal limits. Thank you very much.